thank you so much. So we're going to go next on to Milo LeGendre, and from Chartara Labs. Chartara Labs is a clinician-built data visualization platform that transforms routine mental health data into clear, actionable insights. Created by licensed therapist and PhD student Milo LeGendre, the platform supports evidence-based care by giving therapists and supervisors real-time visual dashboards that track client outcomes, engagement, and clinical performance. Rooted in peer-reviewed research, Chatara Labs enhances decision-making, supervision, and organizational accountability. Milo is now expanding the platform with AI-powered progress note writing, clinical pathways and referral analyzer, and automatic practice management software data extraction, creating a full ecosystem for data-informed care in behavioral health. He's here to demonstrate the system and connect with professionals passionate about clinical innovation. Thank you so much, Milo.
Thank you, David. I really appreciate you inviting me to join today and definitely support your initiative to help enhance AI utilization in the industry. It's a really exciting time in the industry, so definitely support your endeavor there. But hello to everybody else, and nice to be with you today. My name is Milo LeGendre. I'm a licensed mental health counselor in New York State, and I'm also a PhD student in social policy and behavioral health administration in the field of psychology. So I did build Chartara Labs, and Chartara Labs is a data visualization and machine learning tool for therapists and organizations to enhance their efficiency and improve clinical outcomes. It's grounded in real-world clinical and organizational needs. So I'll go ahead and share my screen here, and I'll walk you through a demo of the platform. The platform is not even 2 months old, and at this point, I'm interested in any feedback, investors, collaborators, and users. So I'll add my contact information in the chat at the end, but wow, there's so much to this platform. It almost seems like whenever I present it to people, there's not enough time to get through it all. It's a therapist, supervisor, and administrator facing platform. And the beauty of it is that it's backed by scholarly, peer-reviewed research in psychology and behavioral health administration. Inspired by my work in routine outcome monitoring, thinking about the barriers to measurement-based care and taking a data-driven approach to treatment, seeing how the treatment is going along the way, and using the data to back up adjustments a therapist may make to their approach. Taking a look at the literature on evidence-based practice fidelity, what are the barriers to organizations implementing a culture of evidence-based practice implementation in agencies and workflows, and really thinking how could technology be applied to solve these problems. And then also, I thought about cultural competence and taking my whole career into consideration and how, coming up as a therapist in New York City, cultural competence is always something that is highly talked about in the field, and it's very valued in academic settings. So I wanted to think, how could we take technology and leverage that further to enhance cultural competence training? So that's another aspect of the platform. Log in and show you a few of the data visualizations that are a part of the platform. This is the minimum viable product, the MVP, as they say. It's in its very early stages, and right now there are 17 data visualizations that are accompanied by machine learning analytics. Right now, the artificial intelligence is based on rule-based engines, statistical models, including machine learning, and there are some natural language processing components to it. As David alluded to, coming up here, I am going to be adding a progress note writer to the platform to create a suite of AI tools. Progress note writing is one of the biggest pain points for therapists, and as an AI platform, progress note writer is important to have. And there will also be a referral pathway analyzer at the intake point of care. So I'll walk you through a few of the charts to showcase the versatility of the platform. So the first one that we have, if we navigate over to the clinical monitoring tab, I'll show you the cultural adaptation tracker. So this is a powerful cultural competence training automation tool. And I personally have seen nothing like this in the field before. If we think about the use case for this, it could be helpful for mental health interns. It could be helpful for early career professionals or any psychologist or therapist who wants to market themselves as cultural competence. They can use this as a self-disciplinary tool to monitor their evidence-based practice interventions and how they align with cultural competence. So the way the platform works is we have an Excel spreadsheet right now, and at the bottom of the Excel spreadsheet are tabs. Each tab is one of the charts. So at the bottom, there would be a cultural adaptation tracker tab, and you would put in data points like the client, what is their ethnic background, what is the cultural adaptation you used. Was it a CBT cultural adaptation or was it another type? How did the client respond? And this platform, once the Excel spreadsheet is uploaded into the system, it creates automatically, instantly, this data visualization. And importantly, for all the charts in Chartara Labs, the importance of data visualization can't be discussed enough, honestly, because it's backed by research and data visualization, it leverages human visual processing capability to decrease cognitive load and increase decision making. So that main point here is that usually therapists on the job, they're looking through their practice management software. It's a bunch of convoluted data points. The data points are well intentioned, but you're usually having to click through so many times and you're just looking at numbers and names on a screen. And data visualization in the form of bar charts, heat maps, dot plots, and what have you, it changes that. And I believe it causes a motivating experience within clinicians to apply themselves more to routine outcome monitoring. If you hover the mouse over the horizontal bar chart here, it'll tell you in the Hispanic Latinx section, for example, this blue adaptation type was family involvement. The number of adaptations is 5. The green one is language literacy. The number of adaptations is 4. Now we're looking at still looking at the Hispanic Latinx. Let's move down to the Black American part of the bar chart. Family involvement, number of adaptations is 2. Let's just go over to the red bar. Religious and spiritual reframing, number of adaptations is 3. So instantly you get to see a breakdown of how your cultural competence work is being applied, and you can self-analyze and make corrections. At the bottom of every chart, there are descriptive statistics, there are predictive analytics as well. like I said before, there's just so much to these routine outcome monitoring metrics, and the behavioral health industry is so versatile. I'll move on here and show you the next chart, but another important element is for each chart, you get an instant PDF report. So this is important for supervision purposes because the platform seeks to enhance routine outcome monitoring, supervision. I call it a supervision engine, business intelligence, which I'll show you next. There's revenue analysis. And when you can get these instant reports in the form of PDFs, the possibilities are endless for the use cases for supervisors, for administrators. Take this into a staff meeting, take any one of these data visualizations into supervision, use these PDF reports to inform the support you may provide to the therapist. And that's what I'm getting at here with the PDF report, the instant PDF report component of the platform. Okay, so the next one I'll show you is under the clinical monitoring section. There's a PHQ-9 score individual client tracker. There's also a GAD-7 tracker. I'll show you the GAD-7 tracker. As many of you know, GAD-7, it's one of the most validated tools for anxiety screening in the psychology industry. And this chart, it visualizes that for you. So, longitudinal anxiety monitoring with evidence-based clinical decision support. There's a client selector. So, for instance, right now we're looking at the hypothetical client Megan. It's a color-coded longitudinal line graph um, that shows that her anxiety has started off in the severe range, moderately severe at 15, but then it's taken a bit of a dip and gone into the moderate range. And then we also have new forecast, which is this dotted line right here, the orange dotted line. So obviously in a chart like this, forecast line, it's not meant to be looked at as like set in stone or a fact per se, but you can see like the therapist using this, they might say like to themselves, wow, it looks like the trajectory is going down. The software is telling me based on the predictive analytics algorithm that her anxiety can be expected to decrease. What am I doing right that's causing that? Or oppositely, let's try to take a look at a client whose anxiety is increasing. Okay, anxiety forecasts here, like it'll show like how's the treatment going? Like what are you doing right? What decisions may you need to adjust? And the data visualization, it helps with that. So below, there's some more descriptive statistics down here and the PDF report for every chart. This one in the business intelligence section, revenue by CPT code. I've not seen anything like this before in the industry, and this could be helpful for private practice clinicians. Um, this software, it can be very helpful for organizations, monitoring, supervision of therapists. It's meant to scale, but for the private practice practitioner who wants to monitor their use of certain CPT codes, this chart, it acts as a CPT code usage and opportunity analyzer for ethical use of appropriate CPT codes. So it'll give you an analysis of how much revenue you're generating based on each CPT code, each, billing code. And this down here is what I feel is very helpful because many therapists may engage in a session with a client and have an opportunity to bill for a certain type of code, such as like a crisis code, for example, but it may go over their heads and they may not always realize, that they have that opportunity to bill for that. So taking a look at this software and these data visualizations, as well as the documentation requirements guide that I provide, it's very practical for therapists in private practice. I'll take the last couple minutes to show the behavioral activation tracker. There's also an automatic thought tracker, and these visualizations are a little bit unique because they are meant to be client facing. Most of what I have so far, it's not meant to be client facing. These are, and it's backed by research because when treatment progress is shown in graphs to clients, it creates a sense of shared responsibility and collaboration between the therapist and the client and can enhance treatment outcomes. So here it's behavioral activation visualized and analyzed with machine learning analytics. Very sophisticated and very thorough. So it's the type of software where you really have to dive into it yourself, click around in it and use it yourself. But as I said before, there's a lot to it. The last thing I'll say, David, is for any potential investors out there, I would just say I have lots of ideas. I have PhD level domain expertise. Look at these novel tools I've been able to develop across a variety of mental health outcome measures and organizational tracking data sets. Imagine what this platform could do with more support and my continued vision. I haven't even started substance use disorder charts yet. I haven't even gotten into trauma yet. The progress note writer is on the way. The AI is going to be enhanced. I think it's a very exciting platform that can help therapists, supervisors, and administrators and really help organizations at scale. I really appreciate your time in letting me present.
Thank you so much, Milo. Really appreciate it. Looks, I think there's certainly a lot of potential on the sort of data analytics and insight side of things to sort of promote evidence-based practice and to sort of get better insights into business functioning and operations as well. So thank you so much, Milo.